On your mark. Get set. Go!
The day of the 5K this year, we really turned lemons into lemonade. We had horrible weather. We had lightning and torrential rain when we had to call off the regular Winship 5K race at 5:30 in the morning. And what we did instead is we turned our attention to our Winship inpatients in Emory Hospital. And on the 3 cancer floors that are there, we ran a Winship 0.5K. In our view, that epitomized what the 5K and what Winship is about. And that is, we had an obstacle and we found a way around it. For the Winship Cancer Institute, 2015 has been an extraordinary year.
Winship earned an even higher ranking in the U.S. News & World Report list of top cancer programs this year, moving up to number 22 nationally and earning Best in Georgia status again.
And it also, I think, reflects national recognition that Winship is a special place to come for care, to be trained, and to have a career of research and education.
Winship also gained national exposure when 2 well-known Georgians came here for treatment. Eric Berry, who plays football for the Kansas City Chiefs, and former President Jimmy Carter, who told the world about his cancer diagnosis and treatment by Winship doctors.
And they did a biopsy and found that it was indeed cancer, and it was melanoma.
In its commitment to bring exemplary cancer care to all Georgians, Winship expanded staff and services this year at Emory St. Joseph's Hospital, Emory Johns Creek Hospital, and Emory University Hospital Midtown.
This really allows access to world-class care aligned with an NCI-designated cancer center in communities where that had not been available before.
Behind the scenes, the critical research work that supports our NCI designation also grew.
We also will have an all-time high in the number of grants that our investigators hold and number of grant applications that they've submitted.
Winship investigators looked at new uses of nanotechnology, new targets in lung cancer, and new ways to engage the immune system. Winship was a leader on a national study that looked at using molecular analysis to reclassify brain tumors.
So it's important because the classification and grade that's given with these molecular tests will be more prognostic. The patients will know whether or not their disease is more aggressive and requires more aggressive therapy or is more sensitive to specific chemotherapies.
Winship conducted clinical trials that led to FDA approval of 4 new therapies for multiple myeloma patients this year, including 2 immunotherapy drugs.
I think this is really a huge step forward, and elotuzumab was the first. There are other monoclonals that are coming close behind, daratumumab, the SAR compounds targeting CD138. This is going to be just an explosion of new treatment options, and it is very exciting.
And Winship trials also focused on quality of life issues for breast cancer patients.
The clinical trials that I'm involved in have to do with either improving our radiation treatment for breast cancer or trying to understand the biology underlying side effects of treatment and how to minimize or eliminate them.
Winship's prostate cancer program got a big boost this year from a $25 million grant made by the James M. Cox Foundation, aimed at improving patient experiences and outcomes. And support for Winship's research continues to grow, including an all-time high of more than $778,000 raised from the Winship Win the Fight 5K. Looking ahead to 2016, Winship will be implementing a new 3-year strategic plan.
Our view is to think big and think bold and think ambitiously. We need to pay attention to the details of infrastructure and operations, and those are in it. But we're also thinking, how do we want the world to be a better place in our realm 3 years from now because of the activities of the Winship Cancer Institute. So we will be very excited to roll that out in 2016.